So good afternoon, everyone. Welcome to today's webinar session on the sale of e-cigarettes on online platforms despite the ban since 2019 in India. We have our subject expert, Mr. Cyril Alexander, who's the Executive Director from Mary Ann Charity Trust in Chennai, Tamil Nadu. Welcome, sir. We also have Dr. Rakesh Gupta, who's the President and Director of Cipher. Along with him are his student, Dr. Arman Mahajan, who's from Chandigarh itself, and he will be presenting a presentation on the study done by him on the sale of e-cigarettes on online platforms. Dr. Arman, if you would like to go first and just share your findings.
Actually, Arman and me, we are going to present together.
Oh,
Right?
sure.
Some
So
of the slides I'll be presenting, some of the slides Arman will be presenting.
I apologize. So I would invite
Right,
Dr. Rakesh Gupta and Dr. Arman to just present their findings.
So good afternoon, ma'am, and good
Yeah,
afternoon.
is it slideshow?
No, sir. If you can just go full presentation mode.
Okay.
Yeah.
Just do that.
Arman, on the top right corner, जहाँ पर slide show है, वहाँ पर full होगा.
No, just a second. I'll share it.
Yeah. In the meantime, if you have any questions, I would request everyone to put their questions in the chat box, or you can.
And Dr. Shekhar Grover from Chip Foundation is also with us. You're welcome, sir.
Yeah, I also welcome Dr. Shekhar Grover, sir, from Chip Foundation. So it's really good to see you. And if you can also give your inputs little later on, that will also be wonderful, and it'll.
Thank you, Paridi, and thank you, sir, for inviting me on this board. I'll be happy to look into the study that sir has undertaken.
Yes,
And we're hopeful that this will bring out some new evidence on the sale of e-cigarettes on online platforms. And hopefully we get some eye-opening, points from this study outcome, and we can implement that on the grassroots level. Thank you.
Yeah. And Dr. Dilip Acharya is also with us. So you're welcome, sir.
Thank you, sir.
Thank you. So just note down if you have any queries or any questions.
So Arman, you can go ahead. We can see the full slides. Yeah. So you can also see the slides.
Yes. So good afternoon, everyone. I'm Arman, working as an intern under Dr. Rakesh, sir. And sir, please continue for the first slide.
Arman, you are sharing actually. You are sharing.
Yes, yes, sir.
Can you forward the slides?
Yes.
Yeah. So e-cigarettes, they don't come with a warning. Yeah. Yeah. Just show me the poster. So e-cigarettes, they don't come with the warning, but the law does. And under PCAT 2019, actually, we can also check the sale of electronic cigarettes on online platform. Next, please. Next one. Yeah. So I'll be telling you about the introduction of the study which Arman and Ashdeep has done, Ashradeep Singh. So they are my interns actually. They were my interns. Ashradeep Singh was earlier there, and Arman is now also. So these are the. Arman, can you make it?
Yeah, if you can just go a little bit, you can zoom out. Actually, it's already very zoomed in.
हाँ, देखो जरा.
Is it better? Actually,
Yeah, it is better now. Yeah. So these are the electronic cigarettes. They are battery operated. They may contain nicotine or they may not contain nicotine. And there's an aerosolized vapor for inhalation. But though I don't, I mean, describing it as vaping, it is electronic cigarette usage. And it is defined under Prohibition of Electronic Cigarette Act, that is PICA 2019. It is designed with diverse flavors. They say there is more than 7,000, even more than that. And it contains menthol, mango, watermelon, cucumber to increase the consumer appeal and especially among the youth. And then the design mimicry is also there, engineered to look like cigarettes, cigars, hookahs, or they may be diagnosed, disguised as pens, USB sticks, and may even be like gaming devices. Then the regulatory gap is there. It is not covered under COTP Act, but it definitely is banned under PICA 2019. Though the enforcement for online and online sale, offline and online sale, has been very, very weak in India, like in other countries. Next, please. So, how the e-cigarettes work? So, it has got LED indicator or LED lamp is there. The microprocessor is there, atomizer is there, and the heating coil is there, mouthpiece is there, and device is activated when user inhales from the mouthpiece, and atomizer that heats up the liquid in a cartridge, and vapor is produced, and the LED indicator lights up. So instead of vapor, you can even call that the e-cigarette liquid that is heated up, and it is like second-hand smoking. Next, please. So these are the cigar-like e-cigarettes. Then there may be disposable vape pods, vape pens may be there, box or vape mods may be there, and then the skunk. It's called a skunk mods, and other vapes may be there. Other kind of vapes may be there, like hookahs, etc. Next, please. So under PICA 2019, which prohibits the sale offline or online of electronic cigarettes. So if there is a first offense, up to 1 year is the imprisonment, and up to 1 lakh is the fine. And if the offense is repeated, then the imprisonment may go up to 3 years, and the fine may go up to 5 lakh rupees. And there's a fine on even storage. If you let out a godown or a storage space or a shop to a person, even then you are liable to be punished. So there can be imprisonment up to 6 months, and the fine can be up to 50,000 rupees. Next, please. So this is the background. Next, please. Yeah. So absolute prohibition is there in 34 sovereign nations, including India, Thailand, etc., and enacting comprehensive bans covering production, manufacture, and commercial sale of electronic cigarettes. In US, many of the states, they have banned it. The flavored variants to curb youth adoption. And then there can be conditional legalization, like in UK. UK permitted manufacture and sale of but enforces strict controls over maximum nicotine concentrations, and marking and advertising strategies and public promotion channels. So there is conditional legalization is there in UK and some of the more countries also. Next, please. So in 2014, by 2014, actually, it started, the process started in 2014, and 18 Indian states, including Punjab, Delhi, Maharashtra, and Uttar Pradesh, instituted their own state-level prohibitions on electronic cigarettes, but all were under Drug and Cosmetic Act, basically. And then the MOHF advisory that came, Ministry of Health and Family Welfare, they issued a formal advisory directing all duties to halt new licensing approvals and restrict the commercial sale. But that advisory was also under the Drug and Cosmetic Act. Then the Delhi High Court that stayed this advisory, so and neutralizing the executive-led enforcements. But in 2019, itself in September, an ordinance was passed, and it was like PICA 2019, which was an act. It was enacted in December 2019, and the ordinance was in September 2019. But the provisions of the law were imposed with effect from September 2019. Next, please. Then these are the documented health harms of electronic cigarettes. So lungs, they get inflamed. EVALI, that is e-cigarette or vaping product use associated lung injuries. Their respiratory diseases, they are very common in the people who use electronic cigarettes. The heart and blood vessels. Elevated heart rate is there. Blood pressure raises. The blood vessels damages there. And there's higher incidence of stroke and heart attack. Brain, there's impaired attention, memory, learning, mood, and impulse control, especially harmful to the adults. And then the immune system may also be damaged, reduced infection, fighting capability, increased vulnerability to respiratory illnesses. Then oral health is also affected, which includes the gum disease, tooth decay, disruption of oral microbiome. Then the nicotine is very, very addictive. It is more addictive even than heroin. And a single session can deliver nicotine equal to multiple cigarettes. Dual usage with tobacco is very, very common. Next, please. Then people say that with nicotine, normally the cancer doesn't happen, but vaping aerosols, they contain very toxic, cancer-causing chemicals, carcinogens that cause DNA damage, chronic inflammation, and oxidative stress. While the long-term cancer impact is still being studied, uh, but uh, but it is a cancer promoter. And then the cellular and immune toxicity that there, flavoring chemicals such as the diacetyl and heavy metals like nickel and lead, they found in the aerosol. They are linked to severe respiratory diseases. Vaping alters the immune function, making user more susceptible to infection and inflammations also. Next, please. Yes, Arman, you can tell about the material and methodology.
So we come to the material methodology. In terms of scale, we analyzed a total of 272 vendor entities. This was a split between a deep dive into 83 active websites and an extensive review of 189 unique Instagram profiles. To find these sources, we used highly targeted Google search keywords looking at terms like e-cigarettes, ends, vaping, and online sales of e-cigarettes in India. Evaluating the first 10 pages for each. On Instagram, we tracked profiles using high traffic hashtags such as hashtag vape life, and hashtag vape India. This robust foundation ensured our data was both highly relevant and reflective of real world availability. Before diving into raw numbers, it was crucial to establish a rigorous statistical framework to validate our observations. We wanted to determine whether the distribution of fraudulent versus original vendors significantly differed across platforms, namely traditional websites versus Instagram. To test this, we set up two competing hypotheses. Our null hypothesis stated that there is no association between fake and original vendors based on whether they operate via websites or Instagram. Conversely, our alternative hypothesis H1 posited that a significant association does exist. We applied a standard chi-square test for independence using the formula. This resulted chi-square statistic came out to 5.7503. Because this value exceeds a critical threshold, the null hypothesis is officially rejected at the 5% significance level. The takeaway here is statistically definitive. There is a clear mathematically significant association whether the type of platform used and whether a vendor is legitimate or fraudulent. So this is the chi-square formula. In this, our observed values are OI, which we actually counted in the field, and our expected values EI, which represent what the distribution would look like if the platforms had absolutely no impact on vendor type. By dividing the squared difference by the expected values and summing up across all categories, we get our final metric.
Yeah, Arman, you can just skip the details, right?
So the key findings at a glance. So when we look at the data at a glance, the numbers tell us a very striking story. Out of the 272 total entities identified, an overwhelming majority are actively bypassing restrictions to sell these products. Specifically, 92.22% of the websites we reviewed were actively selling e-cigarettes. On the social media front, 88.73% of the Instagram handles analyzed were actively selling. And what was the most alarming thing for the consumer safety is more than a quarter, 25.64% of the Instagram vendors were found to be completely fraud. When you break it down into raw numbers, as seen in the table, out of 90 total e-commerce sites, 83 were active sellers and 7 were outright fraud scams. Meanwhile, out of 213 total Instagram handles interacting with this page, 189 were selling and 24 were identified as fraud without delivering any goods and taking the money. So this is the vendor and platform breakdown. So to get a better visualization how these entities are distributed, the bar chart on the left highlights the contrast between genuine sellers and fraud ones. While active websites have a relatively low fraud footprint, Instagram handles represent a massive hub for both active sales and active scams, showing 189 genuine online storefronts alongside 24 verified fraud operations. If we look at the broader ecosystem via the pie chart on the right, we see how the Instagram landscape splits. 72.22% are direct vendors, while 27.78% act exclusively as promoters, driving lifestyle, content, and traffic toward these purchase points. The digital market heavily leans towards the social media. Of the 272 total vendors captured in the study, only 30.5% operate through traditional websites, while a staggering 69.5% are concentrated right on Instagram. Fake versus original analysis. As you can see, 71 of these were original or functional vendors, while 13 were verified fake storefronts, while 15.47% fraud in a localized sample might seem standard for parts of web. Our key fraud insights reveal distinct threats depending on where a user shops. Only standard websites, the fraud rate is quite low, only 6.67%. However, on Instagram, the fraud rate skyrockets to 25.64%. That means a consumer is 4 times more likely to encounter a fake vendor on Instagram than on a website. And these fake sites aren't just stagnant pages either, they attract upwards of 10,000 visits a month, collecting payments upfront and then ghosting the consumer. The fast paced nature of Instagram transactions allow these scammers to quickly delete accounts or change handles, vanishing right after the payment clears. Instagram vendor landscape. Because Instagram represents nearly 70% of the market ecosystem, we need to map its specific landscape out in detail. We can categorize the activity here into 4 distinct operational profiles. First, we have the legitimate selling vendors making up to 88.73% of the ecosystem across 189 handles. These accounts offer diverse flavors and city-specific delivery across major hubs like Delhi, Chandigarh, and Mumbai, frequently offering cash on delivery or direct messaging options to facilitate rapid unverified sales. Second are the fraudulent vendors, representing 11.27% or 24 handles in the specific bracket. They capitalize on the informal, direct message nature of the platform to take payments and disappear. Third, we look at the lifestyle promoters accounts that account for 27.8% of the narrative space. They glamorize vaping as trendy, often featuring influencers with millions of followers targeting youth through highly stylized imagery. Finally, we have the pseudoscience promoters. These accounts host digital events and webinars claiming that e-cigarettes are completely safe alternatives, actively spreading misinformation to counter regulatory warnings. So we have six categories of online e-cigarette activities. Selling websites. Organized e-commerce platforms offer direct sales, complex variations, and user-friendly interfaces. Fraud websites, copycat or fake storefronts pulling high traffic volumes simply to siphon payment data and funds. Instagram vendors, highly agile, localized accounts offering fast delivery, cash on delivery options, and direct peer to peer engagement. Fourth, Instagram scammers, account posing as vendors that take advantage of younger audience taking money and turning unresponsive. Fifth, lifestyle promoters, the marketing arm of the ecosystem, framing vaping as an essential aesthetic choice for impressionable youth. Pseudoscience promoters, the shield for industry, pushing unverified medical and health claims to minimize the perceived risk of nicotine addictions. So, misinformation and youth targeting. First, vendors rely heavily on attractive packaging and child-friendly flavors like mango, watermelon, and menthol. These appealing presentation choices drastically lower the barrier to entry for teenagers. This hooks them into a dual-use problem, where instead of using vapes to quit smoking, young users simply add e-cigarettes to their existing habits, compounding nicotine dependence. This is accelerated by the gateway effect, with research consistently confirming that young vapers are significantly more likely to transition to conventional cigarettes down the line. Compounding this are pseudoscientific claims across social media asserting that vapes are harmless cessation tools, completely ignoring clinical evidence. This market engine exploded due to a COVID-19 accelerated online shift when the global pandemic and the implementation of the Prohibition of Electronic Cigarettes Act (PECA) 2019 forced these vendors away from physical storefronts and directly onto aggressive, highly lucrative online platforms. The conclusions and recommendations. So, the key conclusions. First, we identify 106 distinct highly active entities highlighting a complex, highly functional, multi-platform digital marketplace for e-cigarettes thriving despite the PECA 2019 ban. This proves that current enforcement mechanism remains critically inadequate as post-ban availability remains widespread. Second, the market is highly unsafe on a consumer level. Fraudulent platforms, both fake websites and Instagram scammers, are undermining consumer trust and heavily signal the immediate need for advanced cybercrime intervention. Finally, the culture impact cannot be ignored. Lifestyle glamorization on Instagram is actively driving youth adoption, supported by pseudoscientific claims that distort public understanding and the growing threat of dual use nicotine addiction. It is clear that policy enforcement must evolve past physical checks and begin aggressively monitoring the digital spaces where our youth spend their time. Thank you. And now, sir, please continue.
Okay, so I'll be telling about the policy recommendations for online sale and the government capacity building, that is Ministry of Electronics and Information Technology and cybercrime wings of the police departments in the states or the UTs. They need training and resources to identify and act against the illegal online sale of electronic cigarette. And then the youth awareness campaigns that need to be done. Adolescents may be educated that the nicotine is harmful in all the forms, not just tobacco. And substitution of one addiction for another is not a solution. We must reject the harm reduction narrative of the vape industry or the electronic cigarette industry. And it is no non-electronic nicotine delivery product are completely harm-free. The harm reduction concept is misleading and may encourage the dual usage. We must strengthen the Prohibition of Electronic Cigarette Act or the PICA 2019, and we must strengthen the enforcement. International collaboration on monitoring, surveillance, and enforcement act before electronic cigarette use reaches epidemic promotions among the youth. Next, please. So study at a glance, as Arman has already told you, that PICA was enacted in September 2019. The sites reviewed were 90 websites, and profiles of 213 were analyzed. Then selling online, 272 vendors were selling online. Then fraud rate was as high as 25.65%, 64%. And the study reveals a thriving multi-platform black market for electronic cigarettes in India, operating with near impunity. And despite a comprehensive 2019 ban, misinformation, youth targeting, and fraud, they are very systemic. So the way forward is stronger PICA enforcement by the people who are responsible for checking the online sale, especially the offline sale is also there, but our online sale is too much. Then cybercrime wing that has to empower. The youth education campaign has to be done. International collaborations had to be made. And then counter misinformation strategy on social media has to be done. So thanks a lot. So over to Paridhi. Yes, Dr. Paridhi.
Thank you, Dr. Arman and Dr. Rakesh, for the presentation. So we will ask Dr. Cyril to first give his comments, then take the questions.
Yeah, you can just acknowledge the presence of.
Yes. We would also like to welcome Dr. PC Gupta, Dr. Rakesh Gupta from Rajasthan, Dr. Aruna, Mr. Sukhwinder Singh from Chandigarh. A very warm welcome to all of you, sir, and welcome to today's webinar. If there are, I would
Yeah,
request.
we can ask Mr. Cyril for
Yeah.
his concluding remarks.
Yeah. I would request Dr. Cyril, if sir, if you can just give your comments on the presentation, and if you can also share your expertise with us.
Thank you very much. Thank you for sharing, Dr. Harman and Dr. Rakesh Gupta. It's a very good study because we have a act. The electronic cigarette has been banned, but still the product is available, and then there are many loopholes also. So really, we have to identify the gaps and challenges, and then representing to the government is very important. So when we have some evidences, and then we can consolidate all these kind of evidences, and then we represent to the government, and then we can definitely will come up with a stronger enforcement guidelines. So regarding this study, I think you covered almost all the aspects of social media thing. I think the digital marketing, because nowadays there is no conventional marketing. No need to go to some shops or some vendor places to get all these products. The product is coming to your home, and then anybody can purchase this one without any age verifications also. Here the digital marketing, at the same time the cyber crime also, it's a major issue, because most of the states the cyber crime department is they are not considering this electronic cigarette. If they are able to work very efficiently, and then they can ban this product in the digital platform also. There are some states where you cannot order this kind of products from their states, and other states the product can be ordered, and then even without verification of the age criteria, and then they are delivering to the homes. So that's the thing. And then nowadays, now you identified one. Another thing is the scam and fake Instagram accounts and other things also. It's in future it will be a big issue, especially the children when they are addicted, and then they want to purchase, and then they will go for the fake and other fraud scam websites, because they will offer you for a very cheap or something like that. They will catch, and then they will get your money. So in future this will also will be the big issue. I think we have to address this one also. And then the promotionals also, it's happening through the OTT platforms. The movies, they are just simply showing their product, the electronic cigarette products. Definitely there will be a linkages between the sellers. Even though we don't have a industry, electronic cigarette manufacturing industry, but it's available in all our children's hand and youth's hands. Really the enforcement, it's a big issue. So this kind of study definitely it will help to give more information, more strengthen to the issue, and then definitely we will get some guidelines, and then maybe we can come up with other states also, other state studies also. It can be in the national level, and then we have to approach the government and come up with some strong enforcement guidelines. Thank you.
So, Dr. Dilip, do you have any comments to make?
I must congratulate Dr. Rakesh Gupta and Arman for a wonderful study they have done there. You know, the first time I came to know about e-cigarette was when I was presented an e-cigar by one of my Chinese colleagues in a way back in 2009 in the World Conference on Tobacco held at Mumbai. After that, we have been working against it. In 2013, I had a presentation in APEC, Japan, then again in Malaysia in 2019 against e-cigarettes. So it is very that the study is publicized, because 25% fake will also give a impact on the people not to go for these fake websites, and that way there will some curtail on the people purchasing that's on the website also. But as like the pointed out very rightly by Dr. Rakesh, we have to work on all the fronts to at the same time, because the government has made the rule, but the implementation is very low level. Because if you might have seen, there were two senior people, cricketers, were seen smoking using e-cigarettes. So that is one of the things. Regarding the health hazards, popcorn lung is a very common disease which has been the Diwali. Popcorn lung is one of the main common things. And recently I came with a paper about in May 2026 only regarding e-cigarettes and cancer. So there is a lot of work going on that front also. So all these things will create more and more awareness amongst the youth to prevent them from starting smoking and the dual use also. So once again, thanks for inviting me for this. Thanks, sir.
Yeah, thank you. So, Dr. PC Gupta, are you there, sir? Dr. PC Gupta?
Yeah.
Yeah.
Yeah, no, it's a very interesting and very important topic, because although it is banned, the promotion and in different forms and marketing is going on rampant. And we know that it is affecting especially our younger generation, adolescents and young persons. So that is why, full understanding and control, based on the kind of research that you have done and you have presented, I think is absolutely crucial. So it's a very good initiative, very good work, and we need to go a long way to really get rid of this particular menace, which is really being promoted not only by the industry, but by many people whom we consider, so far we had considered as exemplary public health people. and they have also somehow come into that lobby of harm reduction. And also, you said tobacco, but the industry and web is not addressing the problem of tobacco at all. They are only addressing the problem of cigarette and cigarette smoking. So I think that is something that we need to always say, that this is only for cigarette. That's what they are claiming. Nothing to do with chewing tobacco or BDs or any such thing. So I think those are the distinction, especially for India, we have to keep in mind. Thank you. Thank you very much.
Thank you, sir. Thank you. Sukhwinder, do you have to say anything?
Sir,
Yeah.
sir, really, you are really doing a very excellent job. You are doing, and your organization is doing, and I've seen and gone through the today's presentation given by the Arman. It is really a wonderful study. In my opinion,
And
as
Mr. Sukhwinder, do you know that Arman is not from public health? He's a computer science graduation, doing still graduation.
oh,
And still
great,
he
sir.
has done a very great study here.
Great, sir. Great, sir. Great, sir. So,
But another author is a public health graduate, Master of Public Health. And now he is doing PhD in PGI, Chandigarh.
great, sir.
Ashram district, yeah.
So, sir, as everybody said that yes, it's a big issue that everybody is now the whole, you can say globally it is, everybody is facing this issue. So in my opinion, yes, one of the speaker rightly said that yes, we have to curb this practice of this promotion through the this through the websites and all that, or e-platforms, the way it is being distributed among the children's. So in my opinion, like in food, what is happening that even the Zomato, Swiggy, and these people, they are only able to deliver food once if the license holder is registered over there. So we can hold this, we can curb this practice of selling the e-cigarettes on the e-platform. And yes, the police under which the this crime is there, so they can control it by banning this promotion of these e-cigarette on this platform. And second, I would like to say that yes, it is very important that every institution must involve, and there must be a awareness program in every and each institution and organization, though it may be of a 15-minute program, though it may be of a half an hour program, where the regular you can say awareness should be given. And in the schools also, where there is a PTM, where there is a parent teacher meetings over there, so the parents should be guided, the parents should be they should be aware about the ill effects of these e-cigarettes. So this is very important. And it is not only that your organization or a few police or drug department, they are only to go for this kind of awareness generation. Basically because it is every institution is required to be involved in creating awareness, so that we can able to settle in the mind of the people that this thing is very dangerous for the health of their children. So in my opinion, this is very important. Thank you, sir.
Thank you. I may tell everyone that Mr. Sukhwinder, he is from the FDA department, the food department, and he is doing an excellent work for curbing the promotion of smokeless tobacco and the use of smokeless tobacco. Yeah. Thank you. Thank you, sir.
Thank you, sir.
And may I just request Dr. Rakesh Gupta from RCF for his concluding remarks?
Thank you, Dr. Rakesh ji.
Hanji.
I think everyone has already opined, and it's a very excellent and useful study. I think what is required is that the recommendation that you make integrates the need for amending CODPA. I feel the violations have to be more effective, and the enforcement also has to be more stricter and stronger.
Yeah.
Because we all know that, yes, how e-products, electronic tobacco products and nicotine products are affecting the lives of people, youth in particular in India. So it's time that we really take up this on priority and with all sincerity. That's my small input. Thank you very much for giving this
Thank
opportunity.
you. And I may tell everyone that Dr. Rakesh Gupta from RCF is a very, very senior tobacco control, stalwart, you can say, like Dr. PC Gupta, and he is mentor to many, including myself. And
Not like PC, sir. He's my mentor, our mentor.
नहीं नहीं आपने mentoring तो की है बहुत लोगों की
Yeah.
खासकर tobacco cessation में तो बहुत की. So thanks a lot. Thank you.
Thank you.
So Dr. Aruna DS, if she is available. Dr. Aruna.
So I don't think so. She's
She is
present
left.
right now.
Can we take a snapshot of
Yes.
everyone with
Yes.
videos on? Yeah.
I would request if everyone can just switch on their cameras for just a minute. I'll just take a group photograph. Everyone, please switch on your cameras just for 2 minutes. Okay, on the count of 3, bright, beautiful smiles. 1, 2, 3. I'll just take one more. Yeah. 1, 2, 3. All right, thank you.
You can just proceed with the formal vote of thanks for
So-
all the dignitaries present here.
Yes, sir. So thank you, everyone, for joining today's webinar on the e-cigarette ban. Thank you for giving the inputs. I would first like to thank Dr. Arman and Dr. Rakesh Gupta for presenting their findings. I would also like to thank Dr. Cyril for being the subject matter expert and giving his expert opinions. Along with that, I would like to thank Dr. Rakesh Gupta from Rajasthan, Dr. PC Gupta, Mr. Sukhwinder, Dr. Aruna, Dr. Shekhar for all joining us for this.
And Dr. Shekhar, so we just forgot about Dr. Shekhar. So can he give just very short remarks? Dr. Shekhar, is it there? You're muted. You're muted.
Dr. Shekhar, sir, if you can just give a short brief on your opinions about the whole problem.
I think he is not there.
Yes, sir. He was there just a minute there back. He was there for the group photograph, so I thought he'll be there.
Shekhar, are you there?
Sorry.
Yes, sir.
Took me a while to unmute. Yeah, sorry. So, good afternoon, dear panelists and all the senior stalwarts. I'm glad that this session has finally been conducted and as an eye opener for the sale of e-cigarettes. Yes, we do have a lot of evidence that supports that the ban of the PICA ban is not being implemented to its fullest scale, and probably studies like this would paint a better picture on how exactly we can take this up forward. And we are happy that Dr. Rakesh Gupta sir has taken this initiative and has provided some important findings for this session. So and many thanks for to all the stalwarts for having this round of discussion on how we can implement the PICA ban more efficiently and at the grassroots level, and also for organizing this important webinar. And we hope to see certain we hope to see the young generation taking up studies like this in their own ways forward, and we hope to see much more credible evidence coming out of their studies. So thank you, sir. Thank you, Prakash Gupta sir. Thank you, Rakesh Gupta sir. Thank you, Paridhi. Thank you, Cyril sir, for hosting this important webinar, and looking forward to have many more such webinars in future. Thank you.
Thank
you. Thank you, sir, for your kind words. So once again, I'm just thanking everyone in order. Thank you, Mr. Arman. Thank you, Dr. Rakesh Gupta, from Sipher, Dr. Rakesh Gupta from Rajasthan, Dr. Prakash, sir, thank you for your empowering advice early on. Thank you to Dr. Shekhar and Mr. Sukhwinder Singh. And last but not the least, Dr. Cyril for summarizing the entire PPT. Thank you to all our participants who made the time to join the session. Thank you, everyone.
So thank you. Thank you all.
We'll see you in the next webinar. Thank you.
Thank you.